Hello, good morning, everyone. So, welcome to our first panel, Women's Pay, Wealth, and Health, Where We Stand Today. We've invited 4 experts in the field to discuss the policies that are going on today and how the wealth gap affects our society, how it affects women, and from that, of course, children, communities. So I'd like to welcome and introduce you to Linda Goler Blount, President and CEO of Black Women's Health Imperative. Fatima Goss Graves, President and CEO of National Women's Law Center. Anna Mahathey, Research Assistant, the Institute on Assets and Social Policy at Brandeis University. And Heather McCulloch, Director of Closing the Women's Wealth Gap Initiative. Welcome to all of you. Thank you. Let's start. Each of you can just tell us right now a bit about the work that you're doing and how it relates directly or indirectly to either the women's wealth gap, to solving that issue, or the women's health inequities. Yeah, you can use the mic.
Any order? Or
we can start from you.
Hi again. My name is Heather McCulloch. I've been working as a consultant in the asset building field, really looking at strategies to help low-income families build financial assets for about the last 15 years. I started at an organization called Policy Link that you all may know in the very early days. And during the course of my work, one thing I noticed is that we were talking a lot about the wealth gap, but there was very little focus on women and women of color. And so I just started talking to many of my colleagues, funders, organizers, advocates, to say, hey, shouldn't we be having this conversation? And so that was about a year ago. As I said, as you heard, we've created this initiative, Closing the Women's Wealth Gap, and it's now grown from 10 to 175 women from all different sectors, and we've been looking at the causes and effects of the women's wealth gap with a particular focus on how to close it by building wealth for low-income women and women of color.
Hi, good morning. Again, my name is Anna Mahathey, and I just graduated with my master's degree from Brandeis University, so a lot of my research has come out of the master's degree that I was working on. And it was a dual degree in public policy and women's gender and sexuality studies. So I was looking a lot at the way that our social policies that are targeted towards low-income people, how they impact the various identities that women hold as mothers, as caregivers, as workers, and those various sectors of their lives. Right now I'm a research assistant at the Institute on Assets and Social Policy, and I'm working on 2 different projects. One is looking at healthcare career pathways for low-income people and the various paths that can take, and so trying to apply a gender lens to that specifically, especially because women predominantly work. The healthcare is predominantly women workers. And then I'm also working on a project that's looking at employee stock ownership plans and how that, if that is a mechanism by which women can build wealth and financial stability for their families.
Good morning. I'm Linda Blount, President and CEO of the Black Women's Health Imperative, as we now refer to ourselves as BWHI. It's just easier to say. This is year 35. We were founded on Spelman's campus when Billy Avery brought 2,000 of her closest friends together to talk about how Black women needed to take care of their health. So we began as a self-care movement, and that's still what we are today, but now we're very much focused on looking at our health and the health of Black women and women of color from an asset perspective. Epidemiologists, researchers all talk about disease rates, morbidity rates, mortality rates. Everything's bad, everything's horrible. However, when you talk to Black women, they have a very different narrative. So we're focused on changing that narrative and looking at our health from a position of strength. Yes, we're focused on avoidable chronic disease mortality, HIV prevention, risk reduction, and translating research into programs, investments, and policy, but most important, taking the research and creating a language that the everyday woman can use, that policymakers can understand, to try to get the change in health outcomes that we want to see for Black women and girls.
Good morning. I'm Fatima Goss Graves. I'm the president and CEO at the National Women's Law Center. This is week 3 in that role, but I've been at the Law Center for over a decade. The Law Center was founded 45 years ago, and we work to expand opportunities for women and their families in nearly every aspect of their lives, including opportunities in the workplace, in accessing education, in health and reproductive lives, and working on the programs that support our lowest income families. And we do that work in a couple of ways that I think are important. One is we engage in research and policy advocacy, and we take on individual clients. All of that in our minds is using the law in its broadest forms. And we also, across all of our work, we really center the lowest income women, and we center the experiences of women of color. So I'm really excited about this conversation today because our work there, we really think about the ways in which each of those areas link together and deeply affect the economic security for women. So I like that this is all connected here too.
Thank you. Well, very often in these discussions, you mentioned this earlier, Heather, that the words income and wealth get used interchangeably. So would any of you like to establish for us, what is the difference, what is your understanding of the difference between income and wealth?
Okay. We had a quick hallway conversation on our way in, and one of the issues that you may have noticed is that as a nation we've been talking about inequality now for quite a few years, and that oftentimes what happens is we start off with wealth and income inequality, and then we hone right into solutions around income, and the wealth piece kind of gets dropped off the table. And so one of the issues, I think, is that as a society, we don't always discern the difference between income and wealth. So income is really your cash flow. It's your resources coming into the household. Your wealth is the difference between what you own and what you owe. So it's cash savings for emergencies. It's retirement savings, home equity and business equity, minus what you owe on your mortgage and credit card debt, et cetera. So in the conversation about the women's wealth gap, that was one of the reasons that so many people have come to the table in our initiative. And I'll say again later, please approach me if you'd like to get involved. But it's this issue that we were focusing a lot on. There's a lot of work, and everybody's been involved in this around pay equity and issues related to the workplace. But we weren't talking about these broader set of issues that define women's economic security, which really includes how do women get access to savings, how do they save for retirement, and we'll talk more about it, but there's a lot of reasons that we aren't able to build wealth, and the challenges are structural, particularly relevant for women of color, so that is really sort of the difference.
Any other thoughts?
Well, the only thing I would add is, and they're also so very related. Right? One of the reasons that women aren't able to save for retirement in the same ways is that our retirement, many of our retirement structures are built solely on the income that you've earned along the way, and women make less. So it's hard, in some ways they are deeply intertwined.
How would you say that local policies versus national policies affect these income disparities?
Do you want me to start? I can start, right? If we, right now is a really interesting time because you're seeing local and at the state government doing a lot of experimenting with proactive efforts to raise income while we have this, while we're in this moment at the federal level, right? So you're seeing, for example, raising wages to $15 an hour and not leaving subgroups out of that, not cutting off women's occupations. And what we know is that women make up 2/3 of workers in the lowest paid jobs, and half of those are women of color. And so just raising wages is a critical thing that we're seeing happening at the local level. We're also seeing at the local level policymakers take steps to deal with pay discrimination on the same job, to make it easier for people to engage in care and engage in work. One of the contributors to the wealth gap is the fact that women are doing both of those things in disproportionate rates, right? They're disproportionately the caregivers, and they're, especially for women of color, they're disproportionately breadwinners for their families. So it's been really exciting to see at local levels moving fair schedules possibilities. We just saw that statewide in Oregon, and policies that improve workplace policies that make it possible to engage in care. And the last thing that I'll just add so I'm not taking up all the room at the table, is that at the local level, we're also seeing some innovative tax ideas that, again, make it easier for the lowest income families to save. Right now, our tax system is so dramatically slanted to upper income people that when you think about some of the structural barriers that get in the way and make it really, really difficult for people to save, thinking through how you can have a larger credit for things like childcare, for things like so people who make the lowest incomes can get a little bit back with an earned income tax credit on the local level. There are some really exciting experiments happening now.
And I would add, what happens at the national level gets interpreted at the local level, and sometimes not always as it was intended at the national level. So, Heather mentioned income versus sort of net worth. So these policies that Fatima is talking about impact expense. So women of color in particular, tend to work lower wage jobs. Well, what if their employers don't provide health insurance? That's an expense. They're going to have to pay for health care. And I think probably everybody here knows that medical expenses are the leading cause of bankruptcy in America. So when there aren't child care credits, when there's not equal pay, when there aren't workplace policies that give family leave, for example, for a sick child, or as we're caregivers, an ill parent, that's an expense that also could cost you your job. So now you're out of work, and then what happens? Yes, the unemployment rates are very low now, but if you're that woman with a high school education and 3 kids and other family to support, none of that matters to you. So what we've got to do is figure out how to translate these policies into something that's workable in the community. As the women we talk to, frankly, what happens at the national level, while yes, it does impact their lives, that's not what's at the top of their list. That's not what's on their radar screen. What they're thinking about is what happens when I go into my job and deal with the stuff I've got to deal with, the second guessing, the microaggressions, whatever, and then what kind of control do I have to make some decisions that won't adversely impact my expense, that won't cost me money, that won't cost me my job. And so a lot of the work that we focus on is how do we get that down to the state and local level so that women don't have to face these kinds of choices every day.
Yes, you've got something to say.
Okay, great. I just wanted to say, many of the drivers of the wealth gap are actually structural and based on federal policy. But I just want to mention that, but then also talk about local innovation. 2 of the big ones have been mentioned by my colleagues. So one is part-time workers' access to employer-provided health and retirement accounts. In the U.S., if you work part-time, you might work for an employer who provides employer-provided, employer-based retirement savings accounts, but most part-time workers don't have access to them, and most part-time workers are women. There are other models out there. In Europe, if you work part-time, you're eligible for proportional benefits based on the amount of time you work. I don't know if that policy has ever been under discussion at the U.S. Now is probably, or in the U.S., and now is probably not the time that we'd be able to move it forward, but it's important to know that there are promising models out there. The tax code is another example. So as we've all been hearing, 1% of households receive 80% of the benefits of tax subsidies that subsidize people to build wealth. Most working moms, working women of color, fall in the lower quintiles, and the reason we can't access those benefits is because of the way they're structured. They're often structured as deductions. If you don't itemize it on your taxes, and 2/3 of families don't itemize, then you don't benefit. So home mortgage tax deduction or deductions for medical expenses are 2 examples. So that's the federal umbrella that we're looking at. But the exciting thing is, as my colleagues have said, at the local level, there's a lot of efforts underway to challenge that. So one example in California is, there was an effort to, there is an effort underway to combat one wealth stripping practice, which is fines and fees, which disproportionately fall on low-income families and on people of color and women of color. So San Francisco has created an Office of Financial Justice. They're looking at a whole assortment of fines and fees and looking at how to change them because they see those as a primary wealth stripping mechanism for low-income women. At the state level, we've just created a state-supported program that requires smaller employers to provide their workers access to retirement savings accounts. So there's a lot of innovation. Most of it's driven by folks working at the local level, showing how this work can be done, and then changing it through policy.
Thank you.
I'll just add one thing. I think they've covered. Is this on? I don't know if it's on. Okay. Thank you. Just one other, I think Heather just mentioned a wealth stripping policy, which I think is really important to turn our attention to because so often we only consider the policies that create barriers to building wealth, but we don't think about the policies that are also stripping wealth away from women and from people of color and especially low-income mothers of color. And one such policy is asset limits on government assistance programs. So programs like temporary assistance to needy families or supplemental nutrition assistance program or other programs like that have asset limits in addition to the income eligibility that people cannot have any more than a certain limit. It's usually around just above $2,000. But what ends up happening is that people who are on the program, who are applying to the program, cannot have any more above that cash limit. Sometimes it also includes retirement accounts. It also includes various other savings accounts for education in the future. It might include their vehicle equity or their home equity. And it ends up creating this perpetual cycle where people are trapped in this poverty because people who are on the program can't save above that limit, but people who are seeking to apply for funding have to spend down any savings they have to be able to apply to then be on assistance. And if you put it in a little bit of perspective, you consider an average 2-bedroom apartment in Los Angeles County, California, is $2,500, and that's more than the asset limit. So essentially, what it's creating is that people can't save for their most basic living expenses, and creating this perpetual cycle of poverty.
I'd like to talk a little bit about intersectionality. What role do you think intersectionality plays in not just policy, but also in outreach, advocacy, research?
So this is a really important issue. I'm sure it's been, 8 years now since, I guess, Unnatural Causes came out that talked about the connection between health and wealth. And obviously, the more wealth you have, the more income you have, the healthier you're likely to be. At the end of the day, generally, people don't say, gee, I wish I'd spent more time in the office. They usually say, if I only had my health. So health is really, really important, but it's hard to be your healthiest if you have no money. So, for example, Harvard and Berkeley did a study looking at poverty in the U.S., concentrated poverty. So in Atlanta, for example, if you're born into poverty, you've got a 4% chance of ever leaving poverty. So to be born poor is almost a sentence. You're just condemned to be poor. So that means your health outcomes are going to be worse off. You know, if we could figure out how to disrupt that concentrated poverty system, and you know, we sort of have a, as you mentioned, you know, if you can't save enough money to live in decent housing for fear of losing your benefits, then you know, you're trapped. If we can't figure that out, then we condemn, you know, tens of millions of people to a lifetime of poor health, when at the end of the day, for all of us, health is what's the most important thing. So we've got to figure out a way to from a policy perspective, to connect that to civic participation. People have the opportunity to make their voices known and heard every couple of years, and if we can take that information and present it in a way that people can actually exercise what is in their best interest, then we have some chance of doing that. But it means we've got to have some strong allies.
Well, one of the things that I think is extremely interesting when you're talking about both wealth gaps and income gaps is that, you know, every time people have polled around the pay gap, at least, it's extraordinarily popular. People want to be paid fairly. That's true, men and women around the country, no matter the political party. People sort of feel that intrinsically. It is also true that when you, at least with our current messaging, when you lead with the specific experiences around the pay gap for women of color, which are far larger, then it is less popular. It is, you know, if I lead with the fact that Latinas over the course of their lifetime typically lose over $1 million in wages and talk about that in its connection to retirement, it's less popular overall. And I raise that because if you don't, in our policy work and in our engagement work, figure out how to talk about and work on the full picture of what is driving the income gap, the wealth gap, and its connections, then your policy solutions will be limited, too limited to actually get there. So the reason that the gulf, that the gaps in wages and wealth are larger for women of color are slightly different than they are for most white women. And if you don't actually talk about and name that and understand that, it both limits the number of stakeholders who are really eager to be at the table working on it intensely, but it also puts you in a position where you might have the wrong policy solutions.
Would you mind going into those reasons?
Sure. So, I mean, if you look really deeply at what's happening with Latina women and Black women in particular, and the wages that they earn early on, right? So that's one of the big drivers. Part of it is that they are really concentrated in the lowest paid fields, right? And then those fields are structured in a way, and some of this is tied to the point Linda was making about in poverty, staying in poverty. Some of those fields are structured in a way where there aren't meaningful ladders. There's schedules that make it hard to find other education or other careers because you're working in schedules that are unpredictable and not stable and you can't plan. But some of it are other structures that make it hard around things like credit and debt, right? If you can't save enough initially, it makes it difficult to do, you know, everyday things like banking. Well, you know, that is concentrated in particular neighborhoods, that's concentrated in particular communities. And so if you aren't able to participate in typical system banking, then you end up engaged with predatory financial institutions, right? And so that puts you in an additional hole. And so there are some structural things that are more likely to happen in communities of color, which are targets of predatory financial institutions in ways that white communities just aren't. So if you don't have a fuller picture of what is really driving it, and then you're coming up with an agenda of how do we close the wealth gap for women full stop, then your list will be too limited.
Thank you. Anna, you wanted to say
Yeah,
something?
I just wanted to add that I think it's really important to note that even in this conversation about the women's wealth gap, the term woman that we're using is a very cisnormative term and does not, when we say that, we're not talking about trans women and we're not talking about other gender nonconforming folks. But we do know, I mean, there's not a great deal of data available that captures the wealth discrepancies that they face, but I think it's really important to note that the LGBTQ community, we know, faces the greatest economic hardship because of the discrimination that they face in the workplace, in housing and education, and in other areas of their lives. So just also entering in that, an additional piece of intersectionality, that even as we're talking about the women's wealth gap, that there are some people that don't fit into that kind of rigid definition of woman that we also need to be thinking about.
Thank you. What policies or system changes do you think could be, would you prioritize to be implemented that would break down some of these barriers, cut through some of these circular systems that we're stuck in?
Well, I certainly would move forward with policies that are going to make it more possible for women to do what they're doing right now, which is both working and engaging in caregiving. I think that you have to do that, because that element that they're going to be breadwinners and caring for families at the same time, that's only that piece is only growing. The second piece of that around, and we haven't talked more directly around health, but it's on our minds a lot right now in terms of accessing healthcare, and Linda's point around medical debt, which is so important. We know what the landscape looked like pre-ACA, so we know what happened under the free market, and that was that women were charged more. That was that women-specific health needs were typically not a part of plans on the market, and there was a really significant gap in terms of people who actually qualified for Medicaid and then people who could get insurance either from their employers or on the individual market. So there were large swaths, especially around women of color, of people who were either uninsured or paying a tremendous amount of money for not that great health insurance, right? And so when we're thinking about possibility and dramatic limits on coverage of women's preventative services, including things like maternity care, things like contraception, reproductive health care more broadly. So when I raise that because it's obviously on my mind right now and lots of our minds about what it means to make less, have fewer access, and have to pay more for your care.
And I would say we, in addition, have to look at how we apply science to policies. So to give a quick example, there have been a couple of times an effort to raise the age of screening mammography to 50. It's currently at 40. So for black women in particular, since 18% of our breast cancers occur under the age of 50, if that were to happen, then you get two main things. One, you can't get screened, and if you want to get screened, you've got to pay for it, and who can afford to pay for a mammogram? But also, because of the data, another 1,200 to 1,600 black women die every year because their cancers get detected very late. So while the science itself made sense, the studies were done in Sweden and Canada. There were no black women in those studies. But we know some of the data, so why run the risk of changing policy based on data that is not representative of the people you're going to apply the policy to? So I would encourage, as Fatima was saying, and Heather, and you know this as well, as we look at applying data to policy, we consider, who's in the data, who's asking the questions, what questions are being asked, so how is the policy, how are these policies actually being applied?
Definitely there needs to be more inclusion.
Yeah, so in our coalition, as I said, we're pretty new, but we created a policy and advocacy working group, and also one focused on research, so that's digging into the data. I passed around a visual, a continuum of the types of policies that we're looking at. There are folks at our table that are working on a whole array of policies. So it's everything related to access to financial coaching and advice, access to savings opportunities, investment opportunities, protection from abusive lending policies, et cetera. But even though we started out with sort of a critique of the fact that we're only talking about pay inequities, we really embrace the fact that you have to start with pay equity and you have to start with paid family leave. So those are two big battles going on right now. They're huge, they affect all of us, and they play a gigantic role in the women's wealth gap. Some other smaller areas of policy activity, or I say smaller, but I would say just more focused, are around women's access to financial coaching and advice at key points in their lives. So one thing I learned during our research for a framing paper that we have online, and it includes a lot of data on these issues, is that wealthy women actually get a wealthy people get a tax deduction to pay for their financial advisors. Low-income women can't access deductions unless you itemize. So there's work underway now to really figure out how do you get that tailored financial advice to people, and in our work specifically to women at key points in their lives. There's some really innovative work going on in different communities where, for example, in Alameda County, in the Bay Area, where they're integrating financial coaching into women's health services, into visits after moms have their babies, into at different times when women are going to get health advice, they're also being connected to financial coaching advice. There's some work going on around the country for Latina women, whereby embassies, the asset building folks in the country, Citibank, and then the embassies have connected to give people financial coaching advice when they're in line to deal with their visas, to go through the steps of the citizenship process. So there's different private sector and nonprofit philanthropic sector efforts to weave it in. Another example is around helping women to build and establish their credit scores. So if you don't have a good credit score, you can't access to credit, and you end up turning to predatory lenders. And again, wealth lost through some sort of wealth stripping experience is the same as saving. So if you're losing that wealth, you have less of an ability to save and build your financial security. So again, a lot of innovation going on around that. There's a company called eCredit Hero that helps women to improve their credit scores. 80% of their clients are women of color. And there's other models underway around peer lending. But again, folks are figuring out now how to move those innovations into the policy realm, and that work is still in progress. I'll just stop there.
No, thank you. It's good to know that so much can be done and is being done in communities, because education, knowledge, has such a positive effect, a powerful effect. I'd like to open it up now. We have 10 minutes for questions from our participants. So our facilitators will be going around with microphones. Yes, over here.
Yes, good morning, everyone. I'm Jennifer White with the American Heart Association.
Hi, Jennifer.
I have a question related to more of a grassroots and local efforts around financial empowerment. I wanted to get your thoughts on Susu circles or giving circles as a way to have wealth, well, not just wealth building, but really sowing seeds and making investments within communities. Have you all seen examples of this, or would encourage us to look into this as another way to build wealth and have shared wealth in communities?
We have not worked on that strategy specifically yet, but it is coming up, and so I'm glad you raised it. One of my co-founders, Serena Khan with the Women's Foundation of California, has been doing a lot of work in giving circles and specifically focused on women's economic security. So I think it's a great strategy, but we haven't delved into it yet.
Thank you for your question. Anyone else? Any questions from the audience?
Hi, good morning. This is Marjorie Innocent with the NAACP. Given the efforts to repeal health reform that are going on right now, what do you anticipate could be the ramifications on efforts to address the wealth gap in particular for women? And I ask this question not just for lower income women, regardless of race, but also for middle class women. And that's one. And two, what can women do to help push back against this, no matter what it is that happens ultimately with the efforts, given that there'll always be this underlying force, right, ultimately to push back on where it is we're trying to go. What can women do at the state and local levels and also at the federal level?
I can start. So thank you for that. You're right, if whatever is being discussed happens, it's going to affect lots of people. So we already know, I don't know what the number is now, the most recent number, and I know CBO is going to come out with some other numbers, but let's say 20 million people may lose health insurance. Given the close relationship between having health insurance and your wealth, then for middle class women as well as low income women, we'll see greater expense and likely greater bankruptcies. So whole families are likely to be disrupted, perhaps communities, depending on where the women live. Could be completely turned upside down, have their lives completely disrupted. On the wealth side, on the health side, we're going to see increases in avoidable mortality, whether it's maternal mortality, infant mortality, chronic disease, HIV, because people will lose access to health care. And so the women won't be able to have the access to perhaps the preventive services that they have now. I think that's fair to say. And also just medical care in general. To the second point, be informed, knowledge is power, and then act on that. There's an opportunity next November 2018 to do that. But what we say is get involved in what's happening in your community and know how these policies are being applied in your local community. Get that information and then act on it and make your voice known.
If I could just add just really quickly too, so it's the 20 million people who stand to lose care-ish. We'll see what the CBO number is, but it is also the type of coverage and plans that at least the latest proposal, the type of plans that would be allowed. And including plans that just outright exclude basic services, whether or not it is, again, maternity care, coverage for pre-existing conditions, including really common pre-existing conditions like having had a C-section. So, some of these things, there's this idea that if you pick and choose on a plan that you should just pick the plan that's going to be right for you. But the thing is, if you have ever been unhealthy before or unhealthy right now or in the future may be unhealthy, which is just basically everyone because you can't predict when you are going to be unhealthy, then it is sort of set up a system that the actual markets won't work. So we don't actually know sort of the overall ramifications. But the second piece of that is when you tie that to what does that mean in terms of people having to make hard choices between being healthy themselves or paying for really critical expenses for their family, whether that's food or housing expenses. And those are sort of the tough choices that we know that people have had to make over time, the choices that leave people in debt or leave them to make decisions that they aren't happy about for themselves or for their families. So it's a whole, and overall has the potential to be really seismic in terms of disrupting the ability for families to be stable.
And I would just add to one more point to what Linda and Fatima said. There was a great article in The Atlantic by Andrea Levere of the Roosevelt Institute in January, and she was reminding us of why this is such an important women's issue, and that is because, in addition to what's been said, because before the ACA, it was legal to charge women more for the same plan. So gender discrimination was legal, and we're going to go back to that. So for those women that are thrown into the individual market, you are suddenly going to be more vulnerable to the costs of healthcare if you are in a position where you can even get coverage. And we don't know. I don't know if any of you have been in the independent market, but it's pretty brutal, and prices are rising really rapidly. So that's just another piece of it that's affecting many women. In terms of what you can do about it, I think we've seen a lot of very effective work going on when members of Congress come back to their districts. A lot of women's voices are being heard, and that's really, really important. And then also to advocate at the state level. So if this changes, there are going to be a lot of decisions about Medicaid made at the state level, and we all need to be at those tables.
Thank you. We have time for one more question.
Thank you all very much. I've never heard a single one of you talk about a collective action like single payer. Is there a collective move? Because if we're really talking about health equity for women, we're talking equity in terms of single payer. Your thoughts?
I hate to bring it back to California, but there is a huge single-payer movement underway in the policy front in California. There's a group, Stronger California Network, that's very involved in that. We're not there yet, but it's definitely part of the discussion, so I'm glad you bring it up. Oh, it just got shelved, sorry.
What was that?
Not totally up to date on it. But the fact that it, maybe you could say more about the status of it.
The bill in California, which would seem to be California ideally leading the way on this issue, this would seem to be the best chance in the country for a real substantive discussion about how we can do this financially, systemically in California. And the Speaker of the House, Kevin De Leon, just shelved the bill, and now there's a fairly robust battle with the California Nurses Union right now about bringing it back to the floor. But it doesn't look good, and it's getting kind of ugly.
On the positive note, the fact that it's gone this far in California is good, and it just means we need to keep fighting for it. So thank you for the update.
Fatima?
I sort of related to your point. I think one of the silver linings of having really core and fundamental rights under attack right now is that it also does provide some space, especially at the state and local level, to reimagine the policies that would really, that could really take you to that next level. And so, it's great that you guys are gonna have this time and space to, I think, do a little bit of that over the next day or two. But I think that right now at the national level, this is largely a defensive fight. Let's really try to ensure that over 20 million people don't lose their health care, and that there isn't a dramatic upset of insurance coverage broadly. And I think that there is room to have this second really important piece of what is next, and how do we reimagine in ways that are bigger and bolder. So that's great.
Thank you. We're running out of time now, so I have to stop us here. But thank you for your questions, and thank you so much for helping us set the stage for this strategy session. Fatima, Linda, Anna, Heather, thank you very much.